On the night of the 24th of April 2021, a fire at the Ibn al-Khatib hospital in Baghdad, Iraq, left at least 82 people dead and 110 others injured. The fire was started by the explosion of oxygen tanks designated for COVID-19 patients. A lack of fire detection and suppression systems contributed to the spread of the fire, and many died as a result of being taken off their ventilators to escape the fire. The disaster led to calls for accountability, and Minister for Health Hassan al-Tamimi was suspended by Prime Minister Mustafa al-Kadhimi the following day. The COVID-19 pandemic put a large strain on Iraq. Over 1 million cases have been recorded in the country, more than in any other Arab state. The public is skeptical about COVID-19 vaccines, and many are reluctant to wear masks during the pandemic. Ibn al-Khatib is one of 3 hospitals in Baghdad that were designated at the beginning of the pandemic by the Iraqi Ministry of Health to treat COVID-19 patients. The hospital serves one of the poorer neighborhoods of Baghdad, and a spokesperson for the health ministry stated that it was originally built in the 1950s and was renovated last year to treat coronavirus patients. Patients in intensive care at the hospital were given respirators to assist breathing, and as such would be difficult to transport in the event of a fire. The European Commission released a report earlier in 2021 warning of the increased risk of hospital fires due to the use of supplemental oxygen in wards treating coronavirus patients. On the night of the 24th of April 2021, an accident occurred in the hospital's intensive care unit which caused an oxygen tank to explode. Medical sources told Agence France Presse that the accident was caused by a fault in the storage of oxygen cylinders. A doctor reported that the staff had tried to shut down the hospital's central oxygen system, but the oxygen tanks had already started exploding. The explosion set off a fire in the ICU that spread quickly to multiple floors during the night. Major General Khadim Bohan, head of Iraq's civil defense, stated that the hospital had neither smoke detectors, nor a sprinkler system, nor fire hoses, and that flammable material used in the dropped ceiling of the ICU contributed to the speed at which the fire spread. The ICU, reserved for the most severe cases of the coronavirus, had about 30 patients, and dozens of their relatives were visiting at the time. One witness, who was visiting his brother in the hospital, stated that he saw people jumping out of windows and doctors landing on cars to escape the fire. Iraq's civil defense stated that the fire was under control by the early morning hours of the 25th of April. At least 82 people died as a result of the fire. The Iraqi High Commission for Human Rights reported that 28 of the fatalities were coronavirus patients being treated in wards at the ICU who had to be taken off their ventilators to escape the fire when it had reached their ward. Others had died of smoke inhalation. According to the Pharmaceutical Association of Iraq, at least one pharmacist was amongst the fatalities. At least 110 other people were injured. A reporter for Al Jazeera stated that the number of fatalities was likely to rise because many of those injured had suffered severe burns. With a health system already strained by poor infrastructure and the coronavirus pandemic, the fire, which was attributed to negligence often associated with widespread government corruption, sparked anger amongst the public and led to calls for accountability, including demands for the firing of Hassan al-Tamimi, the Minister of Health. The Governor of Baghdad, Muhammad Jaber, called for the Health Ministry to establish a commission to bring those responsible to justice. On the 25th of April, Prime Minister Mustafa al-Kadhimi held an emergency meeting where he ascribed the fire to negligence and ordered authorities to report the results of an investigation within 24 hours. Al Jazeera reported that the announcement of the investigation did not stop the wrath of those on social media, as Iraqis repeatedly hear of the government declaring investigations but rarely see anyone actually being held accountable for their actions or lack thereof. Al-Kadhimi also ordered the detention of the head of the hospital and the head of its Department of Engineering and Maintenance, as well as the detention and questioning of the health director for the area of Baghdad where the hospital was located. He also suspended the Baghdad governor as well as health minister Hassan al-Tamimi and planned to question them as well. On the same day, al-Kadhimi declared a 3-day national mourning period. He also stated that the family members of each victim would receive 10 million Iraqi dinars. Several countries worldwide issued condolences to the people of Iraq.